Hi, everyone. I think we've still got people joining us, but hopefully we do have members on board, and apologies for being late. I am also sitting in my car because I've just left a meeting with the department about this issue, about the introduction of mandatory vaccinations in high-risk settings, which now includes schools and early childhood and care settings. So thank you to the many members who've sent questions and who have been engaging with us about this issue. So we know that there will be mandatory vaccinations if you are working in a high-risk setting, which includes Queensland schools and early childhood settings. So that will cover workers in the Department of Education who not only work inside state schools, but who regularly visit those state schools. So, for example, your visiting therapists, your regulators, and other people who regularly visit school sites. We did ask union members what your position was around the support for a mandate across the Department of Education, and the Together members who voted up until yesterday evening, we had 68% indicated they did support and 31% indicated that they did not support the mandation. So at this point, and the majority of our union members have supported the mandate. Support or not doesn't change the law, but it does assist myself and Alex and others about what comments we can make in the media and in other public settings about what our union position is on this issue, because the union position is obviously determined by you as members. Now, we know there has been an announcement about the mandation, but there is still no CHO directive. So, sorry, the CHO is the Chief Health Officer. So there is some guidance on the Queensland Health website as to what the mandatory vaccination requirements are. And that is that you must have one dose of any vaccine by the 17th of December, and you must have your second dose by the 23rd of January. So I should say I'll talk about the exemptions process later, and I know that there are some members who are on leave. So we are expecting that the Chief Health Officer Directive will be issued early next week. We're not expecting it today. I think everybody was hoping for it earlier, but I think with the border opening, the Chief Health Officer's office has had some other matters, so they've made this decision, but they're still crafting the actual legal instrument. I know a number of members have also asked us about the broader pandemic directive. Certainly at this point, I would expect that given the pandemic is continuing, that the emergency pandemic declaration would be continued. Obviously, I'm not the Chief Health Officer, so I can't make that decision, but it is certainly something that we would expect to be extended. So what we know and what Alex talked about last week was the fact that there are health directives and employer-determined mandates. At this point, the Department of Education have only indicated that they'll be following the health directive and not the Department of Education. So there wouldn't be, a DG mandate. So that means that if you work in payroll or in another area where you're not regularly attending a school site or early childhood centre, it's highly unlikely that this mandate would extend to you. The health directives and employer-determined mandates have been challenged in other jurisdictions and here in Queensland, and at this point there has been no successful challenge to those directions. But certainly there have been individuals who have negotiated different things around their circumstances, including exemptions. So at the moment we have employer-mandated vaccinations in Queensland Health and in the Queensland Police Service, and there is a Chief Health Officer mandated vaccination requirement in private and public health worksites and also in disability care settings, and that comes into place by the 15th of December. There is also the Chief Health Officer direction and mandate regarding the ability to enter cafes, stadiums and pubs, which comes into place next week. So at the moment, we've had the announcement regarding schools, corrections and youth justice, and that is that we must have, that the Chief Health Officer is going to issue a direction that we must have one dose by the 17th of December and then a second dose by the 23rd of January. So we know that vaccinations is an important part of flattening the curve, and we know that there is growing concern about the new variants, and that with the borders opening on Monday, we will see a significant rise in COVID cases in Queensland. And so that's obviously what the Chief Health Officer has thought about in relation to risk assessments and high-risk settings. We also know that children, so between 5 and 12, will be able to access vaccine after the 10th of January. But at this point, there isn't a requirement, and we don't think the Chief Health Officer directive will extend. It certainly doesn't extend to patients in hospital settings, and it won't extend to students in schools or early childhood settings, and it won't extend to people who are incarcerated in prisons. So with the directions and the timing, so we had some of the borders open the 15th of November. School term ends this Friday, the 10th. You've got to have a first vaccination dose by the 17th and the second dose by the 23rd. The department have sent out an email. So the Department of Education have sent out an email from this email address, the no reply V status at notification. So it doesn't look like a normal department email, and they have asked staff to reply with your vaccination status. So they haven't asked for evidence at this point. You haven't had to upload a medical record. You've just been asked, are you vaccinated? Will you be seeking an exemption, or are you not vaccinated? So as of this morning's briefing, there were 46,000 staff who'd responded to that who were vaccinated. So it's obviously quite a high rate. I know a lot of members have not received the email. So we have given that feedback, and they will be sending it again. There may also be ways that you can provide this survey information without the email, that you might be able to provide it to the department in a different way, and we're hoping that they'll clarify that today. There still isn't a portal. It will be coming soon, where, like you do on your check-in app or other places, that you will upload your vaccination certificate. So there are different forms of evidence for that, and we will find out more from the department about that soon. So there will be an exemptions process. This is based on, we believe, because it's a Chief Health Officer direction, just the ATAGI exemptions list. So that is quite a narrow list, but there are people who are medically exempt from being vaccinated. And that process is not necessarily, that it's not going to be a school business manager or a HR officer or the DG who's assessing someone's medical information. Is likely to be another medical specialist. And so if you are seeking a medical exemption, or you have a medical exemption, then it's a good idea to be talking to your doctor about that, and to indicate to the department that you will be seeking a medical exemption in that survey. I also know some workers are seeking reasonable adjustments around pregnancy, and we've certainly asked that question. We haven't had a firm response to that yet, so we know that that's something we'll keep raising. But it's also important that you talk to your doctor about that, and talk to them about the options. So what I've just come from a meeting, and what is likely to be described in a DG update tomorrow is that if you haven't provided a response to say you are vaccinated to the department, and you are working in one of these high-risk settings, so if you're going to attend a school or an early childhood centre, and you're not on approved leave, that's also important, then it is likely that the department will send you a letter in January saying that you will be suspended from duty, and certainly that you are not able to enter the high-risk site. So there will be a discipline process associated with not providing your vaccination status, because it is a requirement that if you are going to work in this high-risk setting, that you be vaccinated. The possible timeline for that is that the DG will send this letter tomorrow, but that workers will be notified if you haven't provided your vaccination status and you haven't said, yes, I'm vaccinated, that you will be sent letters in early January. So this is still during the school holidays, by the department asking you to show cause as to why you haven't provided your vaccination status, and notifying you that you cannot attend the school site and that you may be suspended if you don't attend, if you aren't vaccinated, because you will not be able to work at your usual place of work. The other thing that the department have foreshadowed is that they will be also show causing people for termination of employment, and saying if you are not vaccinated in accordance with the Chief Health Officer Directive, we will be seeking to terminate your employment, because that is a fundamental requirement of the role, and it's just a requirement in line with this directive. So that is something that they have said that they will do this morning. So we just want members to be very clear that that is the likely consequence at this point. So as I said, I don't have a final version of the DG email that will be coming out, but it's really important that members understand. That's why filling in that survey is really important. If you are seeking to apply for an exemption, it's really important. If you don't work in one of these high-risk settings, this process may not apply to you. I can't give you a definitive list at this stage of who is or isn't out of that high-risk setting, and I don't think the department have that list yet either. They have some people they genuinely know will be required regularly to visit, as I said earlier, like the, AVTs, therapists, early childhood regulatory workers who have to enter early childhood centres all the time to assess them. So those people definitely will need to be vaccinated in order to perform their roles. School visitors at this point, if you are a visitor, so if you are a parent and not a worker, we understand that parents will not be required to be vaccinated. But if someone is coming on site who is a contractor, so if they're from QBuild or if they are an IT labour hire worker, then they must be vaccinated. So that is going to be a requirement, and it will be a requirement for schools to have a checking process. I did ask again this morning, and I was told that QBuild will only be sending people to sites who are vaccinated, so it shouldn't be a big issue. And I know over the holidays, a lot of maintenance work is performed. So, that is up to their employer. But we know that some further information will need to go to people who are contractors on site about these requirements, which exist from the 17th of December. So it is over this school holiday period. Obviously for OSH or vacation care programs as well, they're also covered by this directive. So the OSH providers will be having to go through this process with their staff as well, and any visitors to the OSH. So if they have an incursion or something like that, those people will need to be vaccinated in order to attend the school site and to attend the OSH. So as I said earlier as well, though, children or students and visitors, parents picking up and dropping off, do not need to show their vaccination status at this point. That is not in the CHO directive. Obviously, we can't foresee what might happen if there isn't a particular outbreak next year. There may be different requirements again for parents and even for children if there is an outbreak at particular school sites, as we've seen in southern states. So we have put a lot of questions to the department. Some of those have been answered, some of them haven't been answered yet. So we know that many of you have got questions and concerns. So we are trying to put those to the department as quickly as we can, and we are following up for answers. Please do get in touch with us at education@together.org.au if you have additional questions, and we will try and answer those as quickly as we can. You can also ask the department directly through their email address as well. So these are some of the questions I've put to the department. You know, what about parents? What does this mean for regional and central office staff? And as I said, I'm as yet unclear. So that is still being worked through. When will we know what happens if you have an exemption? So if you have an exemption from being vaccinated, it may mean that you still can't work in your normal job. So it might be that you are medically exempt from being vaccinated and you're not going to be suspended or dismissed, but you may need to be redeployed like a vulnerable person at that point if you have that exemption. I don't know what that looks like at this point, and maybe that will be a risk assessment. So we are still trying to figure that out. Can staff take leave? The DG message last week certainly said that if you were on approved leave, you only needed to provide evidence of your vaccination before you were due to return to site, because their driving reason for this is they don't want to have anybody who is not yet vaccinated on the school site in order to avoid the risk of transmission of the virus next year, particularly or after the borders opening next week, when there is much more likely to be COVID circulating. So that's the premise. If you are seeking medical advice about your exemption, you should indicate to the department that you are seeking an exemption and you're seeking medical advice. I certainly understand that for many workers, it is difficult to see a specialist at this time of year and you may have to wait some weeks. So it is really important that you do go and see your doctor as soon as you can if that's your concern or your worry. Who's going to be checking the vaccination status? It's really important that we have this conversation. I've asked this morning again and hope to get some more answers today about, you know, what happens over the school holiday period between the 17th and the 23rd when we know our school principals might be away from site. So we are certainly trying to work that through about the vaccination status. In the OSH setting, we think it's the people who are in charge of that OSH have got to check the vaccination status of their staff. But certainly we realise this is going to be an additional impost for our administration staff in the main, in the front office, to check someone's vaccination status as well as their blue card, you know, when they're coming in to do work. So it's really important you stay informed about this process, read those DG emails. If you haven't yet got your vac status email and you want to give an indication to the department, it might also be useful to email that the address about vaccinations that's been circulated in the DG email. I'm just having a little look at some of the questions. There are a lot, but the in terms of some of the questions, I know someone said, if you have an appointment with your specialist and you can't get in until later, what happens then? I think it's important you indicate you are seeking an exemption and that, you know, you give that response if you get one of those letters and say, look, I am trying to get some medical advice. Can staff take leave for other reasons? Obviously, yes. That is, you know, normal reasons like parental leave, you know, sick leave if you're sick, or you know, if you've planned a holiday and you're going on some lovely recreation leave, yes. But supervisors and managers are going to have to balance the needs of the staff as a whole. So certainly, I think there isn't an appetite to say it's okay for everybody who doesn't want to be vaccinated to take their leave and then everybody else isn't able to take their leave at all. So that will need to be balanced and there will need to be some of those discussions because it certainly is tricky to make sure everybody has the right to access leave for their wellbeing and also if they need to access leave. I think it's absolutely appropriate and important to email staff and say, you know, that if you should check your junk mail folder of your inbox and make sure if your vac status email's in there that you should, you know, look out for that because it has been sent out. It is an important message and it's not from a regular department email address. So do encourage people to check out for that. Someone's asked about the 46,000 responses. I don't have the data on that. I think the vast majority of those 46,000 responses were people saying they were vaccinated. So that is certainly what the department has indicated. In terms of contacting contractors who are coming in over the holidays to ensure that they are compliant with the directive to be vaccinated, I believe that the department is sending something. They may have only sent it to principals, but we should ask business managers to have that as well. And I have asked that today, but maybe ask your principal if there is a form letter, because I think they have sent it to principals to say to contractors, please make sure you're vaccinated if you're attending our site during the holidays. So in terms of CCs, community education counsellors will be covered by the vaccination requirement because they work in schools, so they will. Someone's asked a question about paid or unpaid suspension. I understand the department may be seeking, so they'll send the initial show cause and they will be trying to move quickly to unpaid suspension. So that is something that I think, depending on the circumstances, it could be paid or unpaid, and they certainly will be looking to do unpaid suspensions in some cases. Someone's asked a question about how is termination of employment different to being stood down? Well, if you were stood down, you may be re-employed. It may not break your employment. However, the termination of employment is obviously a severance of that contract. Being stood down, however, does tend to lead to, in this case, it would lead to frustration of contract of employment anyway for not being vaccinated. So the outcome would be the same, but the stand down provision doesn't give you an opportunity to respond, whereas a discipline process does give you the opportunity to respond and say, well, I don't think I should be terminated because I am, for these reasons, unable to be vaccinated or do not wish to be vaccinated. And it gives that chance to be tested. I'm just trying to see the facilities and hirers over the break. We will also need to say to them if they're using your site that they are likely to need to be vaccinated. So we do need to get that message from the department about that. So that is something that is very important. Okay, I realise I haven't got every question because there are so many, so my apologies. We will try and download these. We are going to collate an FAQ. We've asked the department with the frequently asked questions as well to put that back to members so that you can have those frequently asked questions. Certainly, we are already assisting a large number of members who have questions and who have concerns about this process, or they need some support. So we're here for you, and we can certainly provide you with advice and support throughout this process. As I've said, sometimes the advice will just be that, yes, this is the process and here's where we are, but we can also have a discussion with you about your options. In terms of safety in relation to students and parents, I know a lot of members are very concerned about why it is that you don't want other unvaccinated adults coming onto your school site. We certainly are, talking to the department as well about the broader risk assessment, and that's also what happened in New South Wales and Victoria, is that there certainly was a lot of follow-up when there were outbreaks, particularly at specific schools. If a lot of young people got sick, they often did still move to home learning or rapid antigen testing, or there was other processes to try and keep the community as safe as possible when there were outbreaks. So hopefully we don't have that level of outbreak here in Queensland that we saw in New South Wales and Victoria. But we know with the borders opening, we are going to see a lot more COVID cases, and we are going to know people who are getting sick, and that's why we need to be as safe as we all can. Thank you so much for your attendance today, and I really want to make sure that everybody can get as much information as possible, but that it's also accurate. So this is information accurate as of this morning on the 8th of December. The CHO direction is yet to be published. When that's published, that'll also be the final word really on what that directive means. And we will, the union office will continue to be open and able to take members' questions up until Christmas Eve, and then we reopen on the 4th of January as well. So, we'll be here and able to support you. But it's really important to check out those DG messages as well. As I said, there will be a DG message tomorrow, and that will give some further guidance and be from the horse's mouth, from the department, and hopefully we'll also have a link to their FAQ as well. Thank you everybody for dialing in. We do have several hundred people on here, which is great. But also, I just want to say, I know it's a stressful time. It's the last week of school. Everybody's got a million things to do, and you're having to worry about this as well. So I know that it's really important that you look after each other at this time of year. So please do make sure you take a break today, have your lunch, have a cup of tea, and if you have any questions and we can be of any assistance here at the union office, we are certainly here for you. All right, thanks everybody. Take care.